And I'll introduce myself for those of you who don't know me. If we can go to the next slide on overdue and context setting. I'm Sam Holcomb. I'm a senior director on our practice improvement and consulting team at the National Council for Mental Wellbeing. And I serve as the project director for the CCBHC Expansion Grantee National Training and Technical Assistance Center. So we are so excited to have all of you here today. I know that we've had a few touch points with you throughout the early days of the Implementation Science Pilot. And so I'm excited to formally launch our learning community. So if we go to the next slide, today's session is really going to be focused on getting us grounded. We'll talk about understanding the purpose, the partners, and the activities we have planned for the Implementation Science Pilot learning community, as well as other things that we might have going on. We'll talk about some key research themes that we've identified both from project templates and during some activities and work that we've done in the past year leading up to the launch of this learning community. We'll also talk about learning community approach and potential topics, and then we'll provide some opportunity for input and feedback, both through some polling exercises as well as through a Q&A cycle. So along the course of our conversation, if you have any questions that are bubbling up for you, please share them in the chat. We'll hold some time at the end for Q&A and try to get as many of them answered as possible or follow up where we might need more time. And then we'll talk about next steps. Next slide, please. So this slide probably looks familiar to many of you as part of the Implementation Science Pilot, or as you'll see us call it throughout, the ISP, because we love a good acronym around here. The focus on this pilot is really creating partnerships between researchers and providers that draw on implementation science to advance quality of care and behavioral health system performance and the health outcomes for the individuals that we serve. But when we think about that, I think, the goals of the pilot are listed here, and you've probably seen them throughout in a lot of the documents that have been shared. But one thing I want to make sure that we're relaying as we're starting this journey together is that the purpose of this pilot is really about studying the underlying use of EBPs on the ground and really utilizing implementation science to better understand and support the adoption, fidelity, and sustainability of evidence-based practices in community-based behavioral health settings. And hopefully within that, we'll continue to bridge that research to practice gap. So the purpose of this pilot is not necessarily building evidence for promising practices or modifications of EBPs. It's really around the study of the implementation. Next slide, please. So as we launch this learning community and think about the many layers of individuals participating and where you're at in your phases of actually implementing a pilot or finding a research partner, I want to ground us in what the activities are from our lens, as well as kind of the different roles and responsibilities. So within these pilots, those of you who are on the line, most of you are probably CCBHC grantees. Some might be research partners of CCBHC grantees. But we see you all as ultimately responsible for, doing the work with a researcher to develop, secure funding, and implement those research projects. However, we are here to support you. And when I say we, there's a collective here. So you have a good group and community here that wants to work alongside you in this practice. That includes SAMHSA, that includes NIMH and NIDA colleagues, and then the CCBHC Expansion Grantee National Training and Technical Assistance Center. How we see our support through these efforts is in a few prongs. So one is, providing early support and technical assistance on identifying project areas of focus. There's been some of that work that's happened through convenings, webinars, networking sessions we've hosted up until this point. And SAMHSA will talk about a few other layers of that support that might be forthcoming. Facilitating networking and connection between you all and researchers, and that includes how we can get the work that you want to do out in the field through an established database of existing and potential projects, and we'll talk more about that. And then through hosting of this learning community for participants, where we hope to support you in developing and implementing your ISP projects, as well as connecting you to other training and technical assistance or resource opportunities. Next slide. As we move in today, we're going to have a few different speakers. So like I said, you have a huge community supporting you through this endeavor. So in addition to those I mentioned on the last slide, you'll also see today we have some representatives from the Yukon Innovations Institute who are going to be our expert leads and are actually leading implementation of the learning community alongside of us. MTHI, who is our research and evaluation partner at the network level, and they'll be supporting data collection and dashboarding and analysis of work under the pilot. And then Bowling Business Strategies, we have a lead expert from there who will be serving as a subject matter expert. So thank you to our additional partners. Next slide. All right, so where we are right now, one thing I want to make sure that you are all aware is, thank you for those of you who have been able to and took time to complete your project templates. We know this wasn't an easy activity for many of you, and what we've done with that is we've actually taken the information from those templates and put them into a filterable database that's going to be posted online on a web page that is now live to the world, but we have not necessarily pushed out quite yet. And we will be sharing that link in the chat, and you will get these slides so you can access it. But that website and database are going to be shared broadly with research networks to really facilitate that access to and connection with CCBHCs looking for a research partner. So I know the NIH teams have already thought about the many opportunities they'll have to push this to their networks. And we really want to support you in finding connections to research partners for those who are still looking for that. Next slide. And then finally, I want to make sure you all are clear on learning community purpose, why we're doing this, why we're, supporting you in these endeavors, and what our parameters are. So we really see your work as a huge opportunity in furthering and advancing the field, and we want to support you in that. So we want to hold this space as an opportunity for all of you, as well as this is CCBHC grantees, but I want to add that we welcome your research partners to be participating in this as well. In fact, we encourage it. This will be a space that we hold for gaining knowledge and skills in research practice partnerships and implementation science that can help you either establish partnerships, enhance your partnerships, or consider models of implementation science that might help shape your research projects. Supporting you in participating in the pilot in developing or implementing your project templates. So for those who haven't already, we will continue to support you in thinking through what the focus is. For those who have already, there's a wide range. Some of you have really focused projects already that might continue to evolve, or how you're thinking about what you study might evolve as we go through content throughout the learning community. And then the most important thing, I think, is really holding space for interaction with each other as you work through this process. So as you find partners, as you start shaping your programs, as you secure funding and start implementing research, wanting to hold that space for how you're learning from each other and how that knowledge might be transferred to support others in their journey. So I'll stop there, and I'll actually turn it over to our colleagues at SAMHSA to talk about what you can expect in coming weeks. And the team from SAMHSA today, including Hillel Sapir, Nima Shaf, and Mary Blake, whom many of you are familiar with already, are really what we consider our ISP implementation team on the SAMHSA side. So I'll turn it over to Hillel.
Thank you very much. Well, welcome everybody. A couple of things that we would like to talk about. Could we go to the next slide? Perfect. So a couple of things that we're going to be doing to try to help and work with everybody. The first thing is, I know that people are at different time points in the continuum when we're looking at the implementation science project. So one of the things that SAMHSA's ISP team would like to do is reach out and meet with each of you on an individualized basis. So these are going to be short meetings. They're going to be 15 to 20 minutes. This is to touch base, see where you guys are sitting, if there's any progress. For partnered individuals, we will be looking to see where are you now that you've been partnered. We know that you've submitted your basic information through your templates to us, but we would like to understand now what are the next steps with the research partner, how that collaboration is working, okay? For pre-partnered organizations, we would like to meet with you and discuss the next steps, okay? And I'm going to just mention a little bit later what we're doing from our side, but we'd like to know, have researchers reached out to you? Some of you I know mentioned that you are in current talks with different organizations or with research groups and universities. So this allows us to see if there's been any progress on that. Have you now begun to move towards a partnered phase? And then for individuals who are not able to submit a pre-partnered template due to other circumstances, we would like to be able to meet with you and discuss how your CCBHC is going, and if this is a better time for you to start moving towards with this allowable activity and the next steps going forward with that. As I mentioned, from our side also, on top of just this 15-minute meeting to really meet with you and to see where you are, from our side, we promise that we are going to be pushing out information to researchers. So that is exactly what we're in the phase of doing right now. Both SAMHSA, the National Council, and the NIH are pushing out information to all our research listservs, okay? The next step is that they will be, that we're sending out this information. They will be then looking at those pre-partnered templates that all of you provided to us. So National Council has a database for that, which we'll be directing our possible researchers towards. And then they will be reaching out to you, okay? So please be aware, you might receive a random call from a researcher, a university, a research organization interested in discussing and talking about your CCBHC and looking to see if there might be, a collaboration is in store. And just be aware that they might not know that much about your organization. They would have seen your template, they would have that basic information, but that's about it. So some of the questions might be just opening teasing questions to understand if this would be a good collaboration. And you might receive multiple calls, right, from different organizations. So you guys will be the star of the show. So just be aware, you don't have to necessarily feel like you're forced to agree with the first one or the second one. You might have multiple options, okay? In addition to that, SAMHSA and the NIH, we are also on the back end sending up specific meetings and webinars with researchers so that some of them might contact us first. And so, they have a better general idea of what is going on. So, and if any of those researchers, show and indicate that they might be interested in one of you specifically, we will also pass that information on, okay? So on our side, we are doing our best now to really push out those templates. So thank you for submitting that. And then the final thing is, as I mentioned, if you are a pre-partner template grantee, or you are now just starting to create your pre-partner template, we will be looking to move into that next phase for you, right? Get a research partner for you. And the second part of that is, once you do have that research partner, the next step is to submit a partnered template, okay? So once you have partnered, we will be looking to help you submit a partner template, which would then begin to discuss what are you doing with that research partner. As we mentioned before, a lot of this burden will be placed upon the researcher. They will be in collaboration with you, trying to figure out what works for you. What are maybe your CQI questions? How does that fit into an implementation science project? And then they will be trying to create the methodology, which you will be submitting to us through that partner template, okay? So just as a recap quickly, SAMHSA will be reaching out to all of you to set up a short meeting. This might be through your GPO. This might be, in your normal monthly calls. We could do it at a different time, whatever works best for each individual organization, okay? And we would most likely like to do this on a quarterly basis, just so we have a good idea of what is going on. We want to be able to, so you don't feel like that we're leaving you stranded out there. We really want to make this, make you feel supported in this endeavor. The second thing, as I mentioned, we are reaching out to our research contacts. So please be aware, if you get a random call from a university, that's probably what is concerning. And then once you have partnered, be on the lookout. We are going to then try to create a timeline for you once you've told us, yes, we found a partner, thank you very much. We'll be working with you to create a timeline to then submit your partnered templates. I'm now going to open it up to Mary and Nima if there are any additional comments that they would like to add.
Thanks, Hillel. I would just say a couple things. So one, we just want folks to know that first, I just want to say, we want to applaud everyone who has, taken an interest in this. It's not easy given all of the other things you have going on with CCBHCs. We really want to continue to encourage your participation and sticking with this. So we definitely want to, applaud that. And especially for those of you who have already submitted the pre-partner templates, we know that took a good amount of work. Those of you who have not, we don't want you to feel that that was your only shot. We understand that there's going to be multiple cohorts of folks submitting templates. So it is not too late at all. We will probably encourage another round of pre-partner. I mean, they're rolling in a sense. You could really submit at any time, but also, we might have another folks that submit another cohort of a set of other folks that submit a cohort of templates like in the summer or later spring. That's okay too. So we don't want you to feel that if you didn't submit a pre-partner template that, somehow the time is gone. And we would make the same effort that we're making now to connect, you folks if you were to submit later. So when you do your check-in with the SAMHSA team during this short meeting, we can definitely discuss kind of where you're at and what you would need. If you would like to meet with the implementation science team to create your pre-partner template, so if you want specific technical assistance on that, we'd be happy to meet with you. Also, if you'd like to meet with the NIH team because you're interested in the NOSI that they've put out, we can also arrange that. If there's enough interest, we can actually create a separate meeting just for folks who are interested in applying for the NOSI. To Kelly's point in the chat, would SAMHSA write a letter to support the grant? I don't know. That's something I'd have to look at and get back to you on. I don't know if that's something we can formally legally do, Mary. I don't know if you know, and then we'll get back to you. But that's it. Mary, did you have anything else to add?
Yeah. The only thing I wanted to add is that we're hopeful that this learning community will also provide support to all of the activities that Hillel and Nima have talked about. One thing to think about is that you can go look at the database yourselves, and if you see people who have identified aligned topics or other things, and you are interested in knowing more about what another grantee is doing, or if you see some others have identified they're interested in doing a multi-site, working with other grantees, you can make note of that, and we'll also be asking you about that when we have our check-in calls with you. In terms of what SAMHSA will do specifically related to any applications for the NOSI, I did want to provide some context that this partnership with NIH has really allowed us to prioritize, or to say CCBHCs are an important model to the initiative laid out under the NOSI, and so therefore CCBHCs will be looked at in that light. Whether or not SAMHSA provides a letter of support, again, I don't know if we can do that. We'll look into that, but I did want to highlight the fact that NIH is clear that they would like to support CCBHCs that are able to meet all the requirements of the NOSI and have fundable applications. So it's not as if the CCBHC is irrelevant to the NOSI. It's already been marked as an area of interest.
Yeah, my understanding is, and correct me if I'm wrong, Mary, that we can write a letter towards the fact that you are a CCBHC and that you've been certified, or attestation that you've met those criteria.
Again, we'll have to go back and take a look at what we technically can do in terms of a letter of support.
And then just to answer Amanda's question in the chat, I think you can have an open discussion with any researcher that contacts you. Really, the researcher would be kind of helping to think through the primary design of the study, right? So based on what you've written in the template and what you kind of talked to them about, they would put forward the study design, and then you would be able to tell them with that study design, and it's in conjunction with you, but you'd be able to inform them, like, would this work, would this not work with the design of our clinic? So for instance, if they were suggesting including something along the lines of, I don't know, opioid use disorders, and that's not something that you all treated, or methadone or something, that's not something you all had, you could say, okay, that's not something we have. I mean, I'm just thinking of examples, or we want to focus a study on children and something, and you say, well, we have a limited population of children in this particular diagnostic category, or you can kind of go through and inform them about that. And then if you have any particular limitations or things that you just, staff issues, resource issues that you want them to be aware of, those are the kinds of things to talk about. But they're used to kind of being the ones to design those studies, so you can kind of let them take a lead on that, and then I think that'll give you a better sense of what to give them in terms of expectations.
Nima, can you speak to the nosy? I'm going to put the link to the nosy in the chat, but could either you or Hillel speak to the nosy?
Sure. Yeah, the nosy is a notice of special interest that NIMH has put out that basically calls for kind of implementation science projects in community-based settings or general practice settings, and it does not require researchers to partner with the CCBHC, but it basically does point them in the direction of the CCBHCs, and points to this implementation science pilot that we're doing. And it's one way to receive funding through NIMH to do this, knowing that NIMH funding is pretty competitive, but that technical assistance can be given through this pilot if any research practice partner were interested in applying for the notice of special interest. So it's basically just a funding opportunity that is specific to this pilot, housed within NIMH.
We did just share the link in the chat. I know it was disseminated early on alongside all of the information on the project during last year's grant funding cycle, but we can make sure that we're sharing all of this during follow-up too. Anything else to add from the SAMHSA team? And I think I'm seeing a few other questions or comments come through, so we'll curate those for the Q&A at the end. Wonderful. All right, I think we can move to the next slide then. So for the rest of our time together today, in addition to Q&A, what we'll do is two things. One is we'll have our team from MPHI review early themes from both the project templates we've already received, as well as the needs assessment we conducted last year leading up to this work to kind of lay the groundwork for what we're seeing and hearing that could help shape learning community content and focus in the future. And then the UConn team will actually talk more about what structures you can expect from the learning community moving forward and engage in some information gathering and polling to inform our work together over the next few months. So I'm going to turn it over to Kelsey Sala-Hamrick from MPHI.
Thanks, Sam, and hi, everyone. My name is Kelsey Sala-Hamrick. I'm a senior research scientist and clinical psychologist at MPHI, and I'm also here with my colleague, Lon Stone, who's a senior research associate and project manager for this project. And as Sam shared, we serve as the evaluators for the larger National Training and Technical Assistance Center. And our goal is really to help gather information on all of your TA needs and experience with this learning community, as well as what we'll be sharing today is kind of what we've done so far to gather your perspectives on kind of your needs that have informed this learning community, as well as hopefully additional TA in the future. So we just want to give you kind of a brief overview of some of the foundational pieces of data we've collected so far. So if you could go to the next slide. So as Sam shared, two main pieces of early data we want to share with you. First is the CCBHC Implementation Science Needs Assessment. This assessment was conducted in fall 2022. And the goal of this needs assessment was to really just better understand the needs of CCBHC grantees when it comes to implementing evidence-based practices. We conducted listening sessions to understand areas where different staff at these CCBHCs felt like they might need additional support. This included questions around population type, condition type, treatment types, and practices. And we also discussed current barriers, successes, and needs when it comes to both implementing EBPs and conducting research and evaluation around that implementation of EBPs. And then the second piece of data is our analysis of the research project templates submitted by you, which we'll share a little bit more detail about that in a few minutes. Next slide. So just an overview of some of the things we heard from you. We had attendees that included project directors, clinicians, evaluators, all from different CCBHCs across 8 different states. And here are some of the conditions, populations, and treatment types you all shared with us that were where you might need the most support when it comes to implementing and conducting research and evaluation. So conditions, we heard frequently that trauma, suicide, serious mental illness, substance use, and co-occurring disorders were areas where you felt like you needed additional support. In terms of populations, listening session participants talked about immigrants and refugee populations, as well as serving LGBTQ populations, veterans, individuals with disabilities, and racial and ethnic minority populations. And when it came to treatment types where you were hoping to get additional support in implementation, we heard a lot of folks talk about community-based treatments, peer-delivered recovery support services, as well as group interventions. Next slide. We also talked a lot about different domains that impact EBP implementation and where CCBHC staff felt like they could use additional support within these domains. And so on this table, you see that collaboration and communication was a top area where additional support towards implementation would be needed, followed by database decision-making and evaluation, as well as education, training, fidelity monitoring, and organizational readiness. I'm going to next slide and pass it over to Lon to talk a little bit more about your project template themes.
Thanks, Kelsey. So you all have access now to the database, but so what we really did was looked at those templates that were already submitted to look at what types of keywords that were coming up and areas of focus across these projects. And unsurprisingly, since we found in our needs assessment, those areas of focus really translated to looking at things like cultural adaptation, health equity, as well as very specific EBPs such as medication-assisted treatment, cognitive behavioral therapy, safe and sound protocol. So the areas of focus, like Sam had mentioned in the chat, could really draw out from what we had found in the needs assessment, and it could be other areas of focus for those who are still developing your project templates. And so now I think I'll shoot it over to Michelle.
Yep. Happy to take it. Thank you, guys. So I'm Michelle Zabel. I'm from UConn School of Social Work, faculty member there and executive director of Innovations Institute. And we met some of you when we did a learning community with the National Council last year around really what is a service array for CCBHCs for children, youth, young adults, and their families. So I'm glad to be in this space with you again. And I want to thank you, like Sam did earlier, for just taking the time to be leaders in this space. We know how hard hiring is these days, retaining staff, the fact that you're probably all short-staffed and still showing up to improve our system and lead is really impressive. And I'm grateful to be part of this conversation. So just quickly, so you have a little faith in us in this topic area, Innovations has been working in the space of EBPs for probably almost 18 years now. We've been a a local center of excellence for Maryland for about 14 years, and we've worked with organizations such as yourself to manualize and move forward field-informed EBPs for like well over 30 EBPs at this point. So we have a good sense of how hard this work really is and how the cultures need to come together between researchers and providers to really make this happen to benefit the populations that we're trying to improve outcomes for. So, you know, the SAMHSA taking lead on this and partnering with NIH, you guys taking lead. We're just happy to be here to assist and convene and help share information, context, and let you guys learn from each other. So Gary, if you go to the next slide, I'll give you a quick overview, and let me warn you, the next slides are really about you guys contributing. So you're about to do some surveying with me. So just prepare yourself emotionally because that's coming your way. So we have 6 sessions together. Our goal is to really help build a strong foundation so that you can be both good partners to the researchers, but also have clear expectations of what the researchers should do to benefit you, ultimately to inform the field and help improve those outcomes. We're planning on convening the last Wednesday of every month, beginning in April. It'll be 2 to 3:30 and Eastern time. And so this is an hour-long meeting. That'll be 90 minutes. And our real goal is to give you a good half of that time where we're either in peer-to-peer conversations or we're doing case studies together, but it's actual learning from each other and dialoguing and improving our knowledge base to be successful in this effort. But we do plan on having subject matter experts. The type of experts that we plan on bringing could potentially be some of your research partners. So there'll be subject matter experts, as well as we're looking, and Sam will hit you up for this later, and I'm going to hit you up at least twice. We're looking for some of you who are early adopters in this to be willing to present in the topic area that we're discussing and trying to dive deep into. How you did it, how you organized that. And our goal is that it would be you and the researcher that you're partnered with. And if that's not possible, at least you as an organization who's, you know, really prepared to move yourself to the next step. So we'd have that subject matter expert from the field, usually a researcher in the area of EBPs, yourselves and your researchers, and then a good period of time for peer-to-peer learning. If we could go to the next slide, please. Okay, so this is just a reminder of when things are. It'll be our team at UConn that's sending out the invites. So please look for us and be organized around who you want to attend with you. Make sure that we're capturing the right people. And then I'm hitting you up again to volunteer. Next slide, please. Okay, here's where, instead of just sitting and creating our priority 6 sessions, we thought it would be really helpful if you guys would actually do this with us. So if you could go to Menti right now, and Allison just put the link in the chat box, and your code is going to be the 17253669. There's 2 polls that we're asking you to participate in. And once you complete the first one, the second one will just automatically pop up for you. But these topic areas came from the work that MPHI showed you just a few minutes ago. They came from the listening sessions. They came from SAMHSA's experience and National Council's experience in working with you guys. And so there's a number. We can't do all of them. And so we'd really like to see which ones help you the most in being ready to engage in this effort to actually engage with researchers and work on implementation efforts. So, you know, I will say, I think based on some of your experience and some of what you've said, we did put in culture responsive and equity criteria for even picking EBPs, but thank you for those who are actually filling this out right now, and we'll sit and just watch for a minute of how this actually looks. So organizational capacity so far for the, and right now I only see 6 people have completed the poll. So if everybody wants to weigh in, I'd appreciate it. I'm gonna give it a little bit of time, so that you guys can get a chance to weigh in, and then we'll move to the next one. If I can get us to 20 people, I feel like we'll have gotten a good baseline of what people are really wanting to see happen. You know, I can tell you that in some of these, you probably aren't seeing language that you see in implementation science a lot, like fit or so on, but those things will be embedded throughout in terms of choosing how we would be helpful. So I see CQI has moved up to the top, organizational capacity, which makes a lot of sense. I would also say, if you see something, if you are thinking that as a leader in this work, there's something that we don't have on here, please drop that in the chat, and we will actually, you know, pull the chat, we'll add it into our thinking. But I mean, I can never promise you that we will know everything. So this was our best leveling of options that seem like would be helpful for you guys. So we're up to 26 participants. I really appreciate that. I think we have about 45 people on the call right now that are from CCBHCs or maybe some researchers. So I'm going to give it a little bit longer to get some more people. Again, if you have thoughts about additional things, please drop it in the chat. You're also welcome to email me directly, or Sam or Samsa or whoever, anybody you have an email address. If you come away from this and think to yourself, you know, I wish I had actually put that in, or I'm really, you know, needing some thinking about this. So, okay, so I see this slowing down again. So I see implementation science frameworks, CQI, organizational capacity, which is going to include leadership, climate, and culture, EBP, barriers and facilitators, and then we'll go from there. So this has been super helpful. So you should have flipped, once you're done, over to, oh, somebody voted and like flipped the top one. So your voice does matter. You should, if you haven't weighed in so far, you should weigh in. I just saw somebody, as we flipped over, have it move. So the other thing I just want to be clear about, so you know, a slide ago, I gave you our best thinking about how we would do this. A good half of every session being a chance for you guys to talk to each other. But we want to make sure that if we, you know, if you have other thoughts, let us know what they are, so that we can be really helpful. It's a short period of time that this learning community is stood up for this basic ability to give you a foundation so you can engage. So I think we have 8 people I see so far, so please keep voting. It's like democracy in action. Let's do it. All right. So those subject matter experts are still staying on top. Is that what you want? Or do you want to talk to each other? Keep voting, please. All right, we're getting down to it. This is really helpful. I really appreciate this. Nobody likes to run a learning community and then be off point of what the participants really want or need. So this is really, I'm grateful to you to take the time to do this. Okay, so we'll get this organized. We'll get communications out to you. You know that that actual sessions will be coming your way with emails from us. Please be on the lookout for the invitations. Please feel free to make sure that any team that you include, that you know you've organized that. If you have researchers, like Sam said earlier, please bring them. They'll enrich the conversation. You know, happy to take emails from you later. Also, I'll say it one more time, if there's anything that we missed in topic areas or technical assistance approaches that you want to at least pitch as an idea, please feel free to drop it in the chat or email us. And then, Sam, I'm going to hand it over to you now for the rest of the questions and feedback.
Wonderful. Okay, so thank you all so much for providing us with that information and your thoughts. Like Michelle said, feel free to drop in the chat or reach out afterwards with any other feedback you have, but the lines are now open for Q&A. So please feel free to raise your hand or drop questions that you have in the chat. While we're waiting for those, I did want to flag one thing up front that Mary put in the chat and I talked a little bit about during my time, which is just underscoring the purpose of this pilot and making sure that everyone is clear that it's not to study the effectiveness of promising practices or to develop new evidence related to practices themselves. It really is on that implementation piece, right? It's on the study of the implementation of EBPs, what contributes to successful implementation, what the facilitators or barriers are, and what approaches might help mitigate some of those things. So wanting to make sure as you all move forward in the development that is very clear. And as you're working through some of this, if you have ideas where you're not sure if you're muddying those waters, that's why we're also here to support. You can reach out. We can provide some thoughts and feedback. One question that came up, I think from Ellie, if I remember earlier, and I might kick to our SAMHSA team. No, I think it was actually from Amanda, was around a researcher who had approached an organization separately from the pilot on a study they're currently conducting to see if they'd want to participate, and wanting to ask if they could partner with them in terms of the pilot too. So curious from the SAMHSA perspective, my translation on that is, can existing research be included as part of this pilot, or does it need to be a new research study? I don't know, Mary and Hillel, if you have, Mary, I see your hand up. Go ahead.
Great, thanks, Sam. So I think that it would depend on whether the existing research project is really around the study of implementation science, number one. And number two, if it aligns with kind of what you're doing with your CCBHC. I don't think it would be prohibited per se. The language around the implementation science doesn't say it has to be new research or it has to be a newly developed project, but it does give parameters around kind of what the expectations are for the study, if you will. So we'd want to make sure that it's a project that is being studied in the context of your CCBHC, and it's really to and the project actually fits with your goals for what clinical questions you have around implementation. I hope that answered the question.
Yeah, I was going to second that, and I know that we've had, I believe there were a couple of different organizations that have sent us this question also previously. As long as it is within the scope of the project, I do not see why that would not be appropriate. But you just want to make sure that it's also in conjunction and with you guys in the collaboration. Don't just feel like a researcher who already has a project is just taking over your site without willy-nilly, without your consideration too. We obviously want this to be a collaboration.
Great, and it sounds like that provided some clarity. I do want to go back to, I think Amanda, you had actually posed this question as well, just around what information to provide with the research teams about what it would mean in the expectations for partnering in the pilot. And Mary, you jumped in with some initial ideas. I want to reiterate that and see if there's anything we might want to expand on too. So, key things are, right, leading the research design, the process for development of the research proposal. And then I'm wondering if it would be appropriate to also say that there are other considerations for kind of partnership that might need to happen on the research side could include like supporting any data collection or reporting that might be required by SAMHSA, in addition to whatever is being required by the funding mechanism. And where relevant, potentially participating in learning community or other activities that are stood up for pilot participants. Would that be fair to say too? Go ahead, Mary.
So, I think that would be fair to say, except for SAMHSA doesn't have any specific data reporting requirements for the implementation science pilot per se. We do have data collection requirements related to your SPARS data, your NOMS data, and your IPP data. And if your IPP data provides any useful information for the purposes of the clinical question you're asking, certainly you could share that data with your researcher. But we are not expecting you to report to us on your data per se. All we're requesting is that you report on the progress of your research project in your annual progress reports. And your findings, if you have them.
That's really helpful. Thank you, Mary. Any other questions out there? And understand that being at various phases, this might be a point where a lot of you are still wrapping your heads around the potential and not know what questions you have. Okay, well, if there are no more questions, maybe we can go to next steps. And thank you for sharing that in the chat, Mary. So in terms of next steps, there is quite a few of them, but they're light lips. So join us for future learning community sessions. As Michelle noted, the UConn team will be sending out the calendar holds, and we're also going to be sending out a follow-up email after this session. We'll include links to the slides, a recording. We'll also have a post-session evaluation, which gathers a little bit of feedback and information from you all. So please complete that when it comes out to you. Again, review the database. Get in there, kind of see how things were summarized. Let us know for your group if you have any edits or recommended changes to the information provided for your organization. In addition, as we were doing this, there are a lot of you who have similar interests. So don't be shy in reaching out and connecting to other organizations listed who might be focused on similar areas as you're thinking about, and perhaps they might even have a research partner and could open up things for a different type of partnership with multiple CCBHCs and researchers. Be prepared to receive outreach from researchers. So we're going to be spreading this far and wide. And we want to make sure that you guys are on the outlook for emails that might be coming in, because we listed the points of contact in that database. And I think, can't see if that was Victor or Victoria. Your name's getting cut off, so I apologize. It looks like Victoria. What if we don't hear from a researcher? And is there a time frame? I wouldn't necessarily say there's a time frame, although I would say that we are going to be doing pushes in the next month or so. So keep connected with us through the learning community. Let us know if you're not hearing from anyone, and maybe we can think about some more facilitated support for how to get you connected with potential partners. And also those one-to-one calls that SAMHSA will be hosting is a good place to also explore what other options might be for getting yourselves out there and getting a connection made. And then this database is meant to be a living document and updated as things evolve, and they will evolve. So as you develop partnerships, please provide us both the NTAC and your SAMHSA GPO with your updated partner templates. As you develop them, if things change, or if you have a new research partner and you're moving along in finessing it. And then participants who already have partners, as we said, part of this learning is going to be doing this together. And so we will be outreaching to some of you, asking you to share your early experiences with others, particularly thinking about, how did you connect with each other? How did you identify this as the right fit? What joint processes did you go about to start focusing on an area of interest. So, we want to be learning from those who are a little farther along than others. And we think one of the benefits of this community is that so many of you are at various stages. Anything else that our SAMHSA team wants to add, or any of our other partners?
This one is cheap, yeah.
Not for me.
Great. Well, then, thank you, everyone. We will see you next month.
Thank you for joining this month's Learning Community session. Please take a few moments to complete the evaluation for this session using the following link being posted in the chat. We hope you join us again for next month's Learning Community session.